So if you registered for our 11:15 demonstration waiver renewal application meeting, you are at the right place. And we are going to go ahead and get started. We still have a few people who are logging in. We do have an interpreter today. So if you speak Spanish and prefer to listen in Spanish today, I just want to let you know we do have an interpreter. Just really quickly, Ana Luz, I'm going to go ahead and share with the group, and feel free to correct me if I'm wrong here. En este momento tenemos un intérprete que habla español, Christopher, y tenemos otro intérprete, Carlos. Así es que si prefiere de escuchar la presentación hoy en español, por favor de escoger el globo en español para escuchar la presentación hoy. Muchísimas gracias. All right, so we're going to go ahead and get started with introductions. My name is Ruby Graven, and I am a regional outreach coordinator, part of the OHA Community Partner Outreach Program. I will be presenting today for the first half of the meeting and also providing support for the group today. And, don't hesitate to enter any questions in the chat box or raise your hand if you have questions. We have muted most of you only because we have over 135 of you wonderful community partners joining us today. And some of you may have kiddos at home or leaf blowers going on or other side conversations. So we wanted to be mindful of everyone's time and just know that you are on mute. But we want to ask you to please be a part of the conversation with us today. Raise your hand, let us know if you have questions or if there's anything you want to share. Very important, at the very end of today's presentation, we will be holding our public comment process. I know this is something that some of you are not very familiar with, so I will be talking about that public comment process here in just a moment. Ana Luz, do you want to introduce yourself?
Thank you, Ruby. So yes, my name is Ana Luz Torres, and I am a Regional Outreach Coordinator with the Community Partner Outreach Program. I am the ROC, one of two ROCs for Lynn, Benton, Lane, and Douglas counties. And now I will pass it on to my colleague here, Jacqueline.
Thank you. Hi, good morning, everyone. I'm Jacqueline McCall, the other Regional Outreach Coordinator for the region Ana Luz just mentioned, so the Southern Valley. And happy to be here with you all. Thank you. I will pass it on to Karina.
Good morning, everyone. My name is Karina Reardon. I'm also a Regional Outreach Coordinator with the Community Partner Outreach Program, and the region that I serve is the Coast.
Okay, so I think we got everyone. And what I'm going to do is go ahead and get us started here and pull up our agenda. Just bear with me. So for those of you who are wondering what we're talking about today, we're going to start with just giving you a kind of waiver 101, making sure that everyone is aware of our Medicaid waiver and kind of the basics. Many of you have been a part of our meetings in the past, but some of you were not able to attend those meetings. And what we've heard from community partners is that, you're still trying to understand how the Medicaid waiver works. So we definitely want to just kind of cover those basics. And most importantly, we're going to be spending a lot of time talking about what's changing. So be prepared to kind of go through all the different comments you've already provided and know that we're going to present how we put these concepts together and what those changes will look like. Okay. So for those of you who are not very familiar with public comment, essentially, we're going to give all of our partners an opportunity at the very end to verbally share your public comments. So let us know if you have any input, if you have any feedback related to our draft application or these final policy concepts papers that have been posted recently. That public comment opportunity is really important. I know it's going to feel kind of rushed or maybe a little formal for some of you who are not really used to being, on a timer, or for those of you who kind of just tell us what you're thinking whenever. And just know that the opportunity with the public comment period is really that we are required to document what you're asking, what you're saying, I should say what you're commenting on, excuse me, and it holds us as an agency accountable. So what this means is that we will be required per CMS to get back to you and let you know exactly what we're doing with these comments. So this really creates, transparency. We will also be posting those public comments on our Medicaid waiver website. So this is really a way to sort of document what you're reporting from, and to see what your peers are reporting. Because of that, we want to make sure that we're collecting your full name, your statement, and if relevant, your organization. Know that there are questions welcome throughout the presentation today, but please be aware that these are not official public comments. So if you really want to hold us accountable, if you really want us to share your comments with CMS, it's very critical that you leave those for the public comment period, or at least make sure that you make space for that. And know that we will consider all feedback when revising the application for submission. So, if you share feedback throughout the meeting, but you don't share it during public comment, know that it's not, going to be lost. We're going to review it and it will be considered. So I've kind of already talked about this, but again, I just want to reiterate that really this is an opportunity for us to be held accountable to each other and some of the comments that are coming from your community. Your comments will be reported exactly as written or stated. And for that reason, it's very critical that we're collecting your contact information and, if relevant, the organization you represent. If you've come to this presentation or meeting today as a member of the Oregon Health Plan or on behalf of a member of the Oregon Health Plan, let us know. This will just really help us track, where the input is coming and what our landscape looks like exactly. So if we're finding that communities are sharing specific challenges or issues or things they want to see, it will really help us paint the picture. All right, so just a little bit about Waiver 101. What is Medicaid and the Oregon Health Plan? Many of you know this, but we also have new community partners who are joining and still trying to understand what the Oregon Health Plan is. Know that Medicaid is a federal program that is administered by each state, and the Oregon Health Plan is Oregon's Medicaid program. So in Oregon, we have our coordinated care organizations. These are local OHP health plans that cover medical, dental, and mental health care. So many of you have relationships with your CCOs. You're working really hard. You have been working really hard to foster those relationships over the years so that you can best serve your communities and help them understand how to navigate their CCOs. And for those of you who love numbers, more than 1 in 4 people in Oregon get health coverage from the Oregon Health Plan. So clearly we have a lot of Oregonians who are enrolled in the Oregon Health Plan, teens, children, parents, brothers, sisters. This is a really good conversation. I really appreciate all of you taking the time to help design the Oregon Health Plan. Okay, so we've talked a lot about the waiver. I really appreciate the little hand here, just reminding us to do the waive. People are eligible for the Oregon Health Plan based on their income or for other reasons. And right now we have federal rules that sort of set these traditional regulations or standards related to eligibility and required benefits. But states can ask to waive some federal rules. to have more flexibility, and to offer the Oregon Health Plan to more people and cover more services than usually allowed. So essentially, we are sort of given these regulations, but our communities tell us what needs to change or what needs to work differently to really meet our communities where they're at. And this waiver opportunity is a chance for us to make that change happen. Every 5 years, Oregon must renew its agreement with the federal government around the Oregon Health Plan, proposing new changes and continuing existing programs. And the federal government can accept or reject these proposals. So for those of you who are still learning about the Medicaid waiver, know that this is a reoccurring process. Every 5 years or so, we have this opportunity to look at the changes that need to be made based on your feedback. So there are plenty of waivers. You may have heard of other types of waivers, but specifically for today's meeting, we are talking about the 1115 Medicaid waiver. And this is, the demonstration waiver with the broadest type of waiver that's available under Medicaid. So know that under an 1115 waiver, states may propose to waive key provisions of the Medicaid statute, including but not limited to who is covered, what benefits are provided, how much individuals may be charged for cost sharing, how providers will be paid, and must include a formal evaluation of impact. So one thing we want to make sure you understand is as we're making changes to these Medicaid waivers, we really have to prove to CMS or the federal government that our ideas are budget neutral. So we talk about this as a demonstration waiver. What we're doing is partnering with our community partners and looking at some of the changes we know could really make a difference in the lives of the community members that you work with. But we also have to prove that it isn't going to cost the federal government more money in the long run. So when we talk about budget neutral, we're talking about working in smart ways that are really meeting people where they're at, but long-term not causing more incurred costs. So the 1115 waiver also needs to require a formal evaluation of the waiver's outcomes and periodic reports to CMS. Another requirement of this waiver process is that every 3 to 5 years, we must be looking at the changes that need to occur. So ongoing work is happening, and we need to be sure to amend those changes or make amendments and changes every 3 to 5 years. So just so you're aware of sort of how as a state, we are required to meet certain standards and certain steps as we're doing this work. Ana Luz, if I go too far, let me know if I go into your section. So the 1115 Medicaid waivers are not. So here are things that are not a waiver. And the reason we're talking about this today is because what we realized in the last few meetings is we got a lot of input about things that needed to change that, quite frankly, didn't really need to, be addressed through a waiver. So know that the 1115 Medicaid waiver is not the only way to change how care is delivered. It's not, for fixing every part of the health system that is broken. And this isn't the place for filing a complaint about a specific provider or service. So it doesn't mean, it doesn't mean don't come with these ideas or input. We definitely don't want to be filtering that. We want to make it really clear that there are places, the right places to go for other types of changes, and this won't require a Medicaid waiver. So how do we get to a yes with CMS? What is it exactly that we need to be doing in order to get an approval from CMS based on the input that you're sharing? Well, I think, one thing is to work with our community partners, work alongside you, let you lead the way. And just to kind of go through the timeline of where we've been collecting feedback from you all. Gosh, it's been years. So the first thing is, like, in the last 2 or 3 years, we've talked about what the vision is, and the vision is to center this waiver in advancing health equity. So thank you to all of our community partners who have been saying the same thing over and over for years and years. Notice I'm exhaling. We've been hearing you, and I know there's some days it doesn't feel like it, but we want you to know that a lot of your community input has been documented and the conversations continue to evolve. We've also reviewed existing public comment through strategic plans. So the strategic plan through CCO 2.0 and through the state health improvement plan. Through COVID listening sessions, we've been compiling your input. Through our community partner collaborative meetings, we usually hold about 18 a month across the state. And we're working with different community-based organizations, nonprofits, schools, faith-based organizations, providers, gosh, you name it. A lot of you have been involved in telling us what what your community members are saying and how they need us to design the Oregon Health Plan. And through your input, we've developed these draft concepts. We've engaged stakeholders and tribes for input, and we will continue to do so. And we've continued to revise the concept papers, which have been utilized and leveraged to finalize our draft application, which has been posted to our 1115 waiver website. All right, and Ana Luz, is this you?
I can surely take over. Yes, it is me. Thank you, Ruby. So now we're going to briefly review the timeline of steps in this process. And let me turn on my camera because I just noticed I didn't do that. So there we go. So I would like to mention that all dates are dependent on CMS and may change. So as you see in the timeline under the month of December, we are currently collecting formal public comments for the application. And I know there has been some questions in the chat about when is that happening today. So it's happening at the end of this presentation at around noontime. So hold your comments, write them down, and we will be providing that time for you to provide those comments. Okay, so in January, the changes will be made to reflect public comment, and the final application is expected to be submitted in February, as you can see here. CMS will assign then subject matter experts to work with OHA subject matter experts to start trying to understand why we're proposing certain changes. And it is at this time that negotiation with CMS will take place. And as you can see here in the timeline, our current waiver expires in June. So most likely we will be getting an extension from CMS. And after the waiver is approved before the end of next year, it won't be implemented until 2023 or until the next 5-year CCO contract, all depending on how complex the implementation is. Next slide. So you may be asking yourselves, what is the difference between concept papers and the application? So concept papers describe our strategy for using the waiver to achieve our stated goals. Concept papers are meant to capture the new things we want to do, as well as the vision and the whys. So going from concept to application. Oregon negotiates for changes to federal authorities that define how members become eligible for OHP, what services are available to them, and how providers are paid. Policies described in the concept papers will be formally requested through the application to CMS. So the waiver application is a much longer document, and there are a couple of reasons for that. One, there are more technical details that need to go into the application. And the second piece is that there are some things in our current waiver that we want to continue. And we want to explain that in the waiver and explain why we're going to do that. Next slide. So our policy concepts break down the drivers of health inequities into 4 actionable sub-goals, as you can see here. These are 4 big priority areas of how we think the waiver can help us advance our 5-year goals of eliminating health equity. So the first one is how the Oregon Health Plan can help us as a state achieve our goals of obtaining universal health insurance coverage and ensuring that more people are eligible for the Oregon Health Plan and can easily become and remain eligible. The second one here is to expand where and when Medicaid can cover services that can help people as they experience challenges, different life events, and the transition between different public systems. The third one is continuing to promote more flexible spending and more flexibility on how CCOs are paid to promote population health and enhance value. And the last one is to request some additional financial investments from the federal government that we think could help us specifically address health equity. Next. Okay. So here are topics that you will find on the waiver application. So eligibility, who can be covered by OHP? Cover services, what types of things OHP can pay for, delivery system, and payment. So who delivers services and how CCOs can provide, how CCOs and providers are paid. And then incentive metrics, the description of the quality incentive program, and then budget neutrality, how the changes impact the state and federal budget. And finally, but very important, a very important piece in this is how we will evaluate progress or whenever progress is made. Next. So now we're going to move on what's changing, proposed changes in draft application. And next slide. So we will move into talking about our first priority, which is maximizing coverage through the Oregon Health Plan. Next slide. Okay. So as our vision, Oregon is prioritizing closing gaps in the system that cause people to lose coverage or prevent them from signing up in the first place. So while the Oregon legislature has taken steps to expand equitable access to coverage, the strategies we will propose in the waiver application are designed to address remaining structural barriers that contribute to inequitable rates of health insurance coverage. And so here on the next slide, we cover the why. So about 6% of people in Oregon don't have health insurance. It is important to mention that communities of color and tribal communities are nearly twice as likely to be uninsured, as you can see here on the right side of the slide. Of the 6%, many are Oregon Health Plan members who lose health insurance coverage because of a temporary change to their eligibility, like making more money 1 month. So when people lose coverage, even for short periods of time, they miss healthcare appointments and lose contact with their providers, which means they don't get the care that they need. And delaying care can cause people to get sicker, need more care or overall, and the cost is just greater at the end. Okay. So our goal is achievable. We know that many people without coverage could be getting it, even in our current system. So one key to our strategies is to make it easier for people who are already eligible to enroll and to keep them enrolled. Sorry, about 60% of kids without insurance in Oregon are eligible for OHP. almost 50% of people without insurance in Oregon could get help paying for health insurance through the marketplace. And more than 30% of people without insurance said they lost OHP, and data from the Oregon Health Insurance Survey suggests that many of these people might still be eligible to receive OHP. So now I will pass it on to my colleague, Karina.
Thank you, Ana Luz. Oh, I pulled down my microphone a little closer to my face. Thank you. So we could go to the next slide, please. So our proposed waiver strategies to waive federal OHP eligibility so that kids stay enrolled until their 6th birthday. So this means kids on OHP can keep seeing the same healthcare providers for longer, which results in better health outcomes. For parents and caregivers of kids on OHP, this means that there will be fewer eligibility redeterminations and less worry about whether a small shift in income will mean a child loses their healthcare coverage. And then number 2, people ages 6 and up stay automatically enrolled for 2 years instead of 1. So many people who lose OHP health insurance are only ineligible for a short time and then rejoin OHP. This on and off OHP hurts healthcare outcomes and costs taxpayers money and administrative work. By providing 2-year continuous enrollment, people will have better health outcomes and there will be financial savings. And 3, when people apply, there we go. Go back one more, please. Okay, perfect. When people apply for Supplemental Nutrition Assistance Program or SNAP benefits, OHA can easily enroll them into OHP if they qualify. Many people who are eligible for SNAP are also eligible for OHP health insurance. According to a 2021 analysis on SNAP membership, 17% of adults and 6% of children receiving SNAP were eligible for, but not receiving OHP. Oregon wants to let these people know that they can also receive free healthcare and get them enrolled. Okay, next slide, please. So what this means for Medicaid members. For eligible people who aren't enrolled in OHP, in the new waiver, it'll be easier for eligible people to get enrolled in OHP. Oregon will provide more outreach in different languages through trusted partners and community-based organizations. This means eligible people will get to talk to someone they trust in their preferred language. When people in Oregon sign up for other benefits like food assistance, they will also get information about enrolling in OHP. And then for current OHP members, they will get to stay covered longer. And right now, members need to re-enroll every year, and they lose coverage in if something changes in their eligibility, like a change in income. And in the new waiver, members don't have to re-enroll as often, and temporary changes in eligibility will make them lose OHP. Next, we're going to go into improving health outcomes by streamlining life and coverage transitions. So the vision is for people to have equitable access to the services and supports they need to be healthy and well, especially through times of transition. So why? So when people go through major life transitions, like leaving prison, being discharged from the Oregon State Hospital, or losing housing, they often lose access to their healthcare providers, leading to worse health outcomes. These transitions are even more difficult for people experiencing behavioral health conditions or crises. People lose care during these times because they're often left to navigate the system on their own. And the system includes many separate supports, like the Oregon Health Plan, Medicaid, SNAP, and more. The Oregon Health Authority wants to close gaps in coverage and care, as well as provide defined packages of services and supports for health-related services and social needs. By providing these supports, OHP members will experience fewer gaps in care, which means better health outcomes. People who lose care during these times, People who lose care during these times often left to navigate the system on their own, And with appropriate supports, OHP members will experience fewer gaps in care, which will mean better healthcare outcomes. Sorry, I think I repeated that twice, but that's okay. You can go ahead and go to the next slide. So proposed waiver strategies. Waive federal eligibility rules so that people are allowed to have OHP coverage when they're in prison, jail, or local corrections, juvenile corrections, Oregon State Hospital, or psychiatric residential treatment. And up to age 26 for youth with special healthcare needs. And 3, so that OHP members who are experiencing major life transitions can have social supports. So these major life transitions include things like becoming homeless, getting out of jail or prison, entering or leaving foster care, leaving the Oregon State Hospital, and social supports include things like housing, transportation, food assistance, and employment supports. And we'll get into number 4, proposed waiver strategies, continued, people with
Propuestas que continúan que las personas
OHP can use
que
more
las personas
types
que
of
tengan OHP
providers
puedan ocupar más tipos de
outside the
proveedores
medical model,
afuera
like
del
traditional
modelo
health
médico,
workers
como
and peer support specialists.
trabajadores de
And then 5,
salud tradicionales y apoyo de personas que sean especialistas. Número
services
5,
are available to
que los
support
servicios estén
people during the
disponibles para
disruptive
apoyar a las
transitions.
personas durante transiciones
Karina?
disruptivas. Karina.
Yes, Ruby?
Sí, Ruby.
I'm hearing the interpreter, and I don't think, is everybody else hearing the interpreter at the same time? I'm not sure what happened with our audio.
Yeah, I'm hearing
Yeah.
both English and Spanish now.
Yes.
Me too.
Okay.
Yes,
That's
that
why I
is
started to
correct.
slow down.
Okay, if we could just pause for just a moment and let me figure this out. Please bear with us. Thank you for your patience.
Thank you.
Thank you. And if you could still please try to add interpreter Christopher this time.
Testing 1, 2, 3. Karina, can you hear me okay?
Yeah, I can hear you, Ruby.
Okay. And then Annalise, I don't know if you're there or if Jackie, if you're there, if you're able to test the interpreter channel and let me know if that's working or if it's still conflicting with our English channel.
I don't have the option to choose an interpreter. I'm not sure if anybody.
No, I don't either. That's what I was looking at the bottom. It disappeared.
Okay, did we lose our interpreters?
No, interpreter Christopher Fallas is here. Interpreter Carlos, I know he's also connected.
Okay,
We,
so
we're not in our interpreting booth.
you're not able to go into the
So.
interpreter channel?
Not able to. We just the option hasn't popped up.
Okay, that's very interesting. All right, well, if we could just take a 3-minute break while we figure this out. So if you need to go grab a drink of water, run to the restroom, we're gonna have to circle back. Bear with us here. If we could have our interpreters log out and then log back in, please, that would be helpful. Thank you.
Thank you.
Of course. Hi, Ruby. Both Chris and I, Carlos, are back online.
Chris, you have been added as an interpreter, I believe. Hold on here.
I'm sorry, I don't.
You're not seeing your channel.
No, I see the usual the menu for participants with the screen sharing, the record the live transcript, but no.
Okay, just bear with me, please.
Yep.
Chris, it looks like you have been added as an interpreter. I just received a confirmation. Will you please confirm on your side? Or Ana Luz? Karina, it's up. And
Yes, it's
thank you, Ana Luz. And just to verify, Chris is the person taking over? Okay, we're getting really close here. Karina, I just want to verify that Chris is the interpreter taking over, or do I need to be adding any other interpreters?
Chris is taking over for now, but I believe you're going to want to have Carlos as well.
I am not sure that this function will allow me to do that. So When Carlos is ready to take over, please let me know and I will switch them over. Thank you. All right. Are you ready to continue?
Yeah, I'll go ahead and do this slide over.
Thank you,
So
Karina.
we're on the proposed waiver strategies, going into number 4, waive federal covered services rules so that people with OHP can use more types of providers outside of the medical model, like traditional healthcare workers and peer support specialists, and request federal funding so that services are available to support people during disruptive transitions. And child welfare can meet medical necessity and psychiatric residential treatment services for children in custody of the state. If we could go to the next slide, please. What this means for Medicaid members. Under the new waiver, OHP members will get to keep coverage care and services in more situations. So some of these situations include leaving Oregon State Hospital, other psychiatric residential facilities, jails, juvenile corrections, or prison. Youth with special care healthcare needs will get to keep their coverage until age 26 instead of losing it at 18. People who experience extreme weather events will have supports as well. Youth in foster care or who are transitioning out of foster care, and elderly adults who have both Medicaid and Medicare health insurance. And the next slide, please. We'll transition into paying CCOs for population health. And I believe I'll be passing it over to Jacqueline.
Thank you, Karina. All right, so yes, we are now going to be talking about paying the CCOs for population health, and we'll get into why and why this is important. Next slide, please. All right, so the overall vision for this and the purpose really and the aim is that currently Oregon's, that in order to have that, Oregon's way of paying the CCOs would be predictable and flexible, meaning it would allow more flexibility for the CCOs and how they can spend their dollars, so their money, in order to meet the social needs and really keep people out of the hospital, right? Just preventative care and overall keep folks healthier. Now, why? Why do we want to do this? Well, really, CCOs should be paid in a way that encourages spending in a health-focused way, so focusing on health equity and, again, keeping people as healthy as possible. Now, the specific proposed waiver strategies around this is that the waiver, it would waive federal rules about the way the rates are set, so the methodology behind that, in order for, again, CCOs to be encouraged to spend more money on the health-related care for members. So again, incentivizing CCOs to spend more money on health equity investments overall, and really focusing on that population health for members. And then again, CCOs, their budgets would be simpler and predictable, because in this way, CCOs are able to know what their budget would be just looking ahead. That way, they're able to foresee what their budget is and plan accordingly, which would mean that they can understand how much they'll be receiving, so that really they can plan accordingly and help make system change, which overall would help lead to healthier members and lower the healthcare costs over time. And then in terms, sorry, can you go back? Thank you. And then that last bit there, it would also waive what rules Oregon can make about how drugs are covered, so that this way the cost of prescription medications can be better controlled, meaning hopefully lower the costs. All right, and then what this would mean for Medicaid members. overall is, again, really just focusing on that population health, the community health aspect, and helping overall, you know, just holistically look at health. All right. And then now we're looking at incentivizing equitable care. So this, we know that currently the focus on, or we want the focus on metrics to be on equity and measure how well CCOs will incorporate equity in their care provided to members. We also know that CCOs, while they have improved on incentive metrics overall, many measures reveal inequities, right? So we know communities of color, tribal communities are definitely affected by systemic barriers and racism. So we definitely acknowledge that and want to help improve that, specifically on health outcomes in those communities.
Jacqueline, don't hesitate to let me know when I need to advance the slides, just because I'm also in the chat box. That'll be helpful.
Oh,
Thank
okay.
you.
All right, next slide, please. All right, so how are we going to change those metrics? Well, we are going to split those into two, as we see here in this visual, right? So the first is upstream, which is really focusing on those that help a person be healthy. And then on the bottom half, we see downstream, which are focusing on the kinds of measures and access to care that OH members receive. So in the upstream piece, really think of this as, one example would be the metric that looks at providing culturally responsive healthcare services in an OHP member's preferred language, which I know comes up very much and is very, very important. Also things like screening for social needs, understanding how many of our members need access to very important services such as housing, food. And also we would really be able to better understand how well the CCOs are responding to these. Thank you. And then a little bit more into this is we would be changing the way the quality incentive program is described in the waiver so that more decision-making power is given to communities. So really sharing that power and that voice, right, to folks actually being affected by these barriers and members of the community themselves. And then also we would be hoping that the program can be redesigned better and overall advance health equity. So we would be able to measure where we are improving and where we still need to work on. And what this would mean for Medicaid members is that in this new waiver, overall OHP members and communities will have a greater voice, again, by it being shared with them in the quality incentive program. And as a result, we would be measuring and rewarding improvements that matter the most to the community, and hopefully really have that greater chance of improving overall health outcomes. And again, highlighting the importance of allowing the tracking of those improvements, as well as where it is still needed, and able to track the CCO's performance and how best to support them to meet their members' needs. And I believe I will pass it back to Karina.
Thanks, Jacqueline. So the next section is going to be on focused equity investment. Next slide, please. So the vision is for community-led solutions for health inequities based on community-led investments. Next slide, please. And why? So people don't have equal access to important resources outside medicine that could help keep them healthy, like nutrition, jobs, and green space. At the same time, Oregon has produced big savings through our CCO model. Next slide. So the proposed waiver strategies we'll get into those. The first, state and federal investment toward community-driven initiatives that help eliminate health inequities. So we'll begin looking at those a little bit more. Next slide, please. How will the investments be community-driven? So new community investment collaboratives, or CICs, will decide where to spend money in the community to solve inequities. Next slide, please. Where will the money come from? So some of the money would come directly from the state to CICs, and CCOs would also be required to spend a certain amount of their budget to support CICs. Next slide. What do we need to ask for in the waiver? To implement this strategy, we need permission from the federal government to spend state money in new ways. We also plan to ask the federal government to provide additional money toward this effort. And what this means, excuse me, for Medicaid members, investments in health equity led by communities, stronger community voice in decision-making, design of investment infrastructure is community-led, and improved health for those most harmed by historic and contemporary injustices. Now, Ruby, I think I pass it back to you again. Thank you. You're muted, Ruby.
Hello. All right, so moving on to parts of our waiver that we plan to renew and the parts that will remain unchanged. So parts of the waiver that will stay the same is the prioritized list of health services and the Health Evidence Review Commission. So this is a ranked list based on clinical effectiveness of what types of treatments are covered by the Oregon Health Plan. We'll keep the coordinated care model because remember, CCOs have been a part of our waiver in the past. This is where this idea sort of came to fruition. So we'll keep CCOs because this is working well for our communities. And we'll also be looking at value-based payment methodologies, commitments to care, quality, and access. The community advisory councils will continue, tribal engagement and collaboration protocols for CCOs and OHA. And so when we also talk about collaboration, remember all the work that's been done over the last 2 to 3 years in your regions and those relationships you've continued to foster with your CCOs. So these are parts that will continue. And I also want to just be sure to mention the survey. So many of you have been asking how we're going to keep tracking what input we're getting from community. And so for that reason, we want to make sure you are aware of our survey. We did send that out in the invitation. Part of the reason we're submitting this or sending out the survey to our community partners is because we want to make sure we know where the input is coming in hopes to make improvements on how we're engaging our community partners and our community members. This is really a way to kind of focus and reach out to the communities rather than just waiting for people to come to us, but reaching out and working alongside of you. And the survey will also give us an idea of the people who are attending and whether people are providing input on behalf of a community member or community members under an organization, etc. If you haven't completed the survey already, we've included a link here in the presentation today. If you're not able to find the survey, don't hesitate to reach out and email us and let us know if you need to track that down. We will also be sure for those members of the CPOP team, if you could please copy and paste the link into the chat so that everybody has it at their fingertips. That might make things easier, right? Okay. So before we get started with public comment, I just wanted to check in with everyone, see how you're all feeling. I know we're getting pretty close to that lunch hour. Our meeting does go until 12:30. So I wanted to check in with you all and see if you have any questions before we move into public comment. If you have a question you'd like to verbally share, what you can do is either unmute yourself or ask to be unmuted, or you can just pop it into the chat box. So I'm going to give you a minute here to process and let us know if you have questions before we move into the public comment period. Amy, you have a question, it looks like.
Yes, I do. Thank you very much. Amy Anderson here. I am a recipient of OHP and I also work with OHP members. My question is, there's going to be a new process for meetings going forward after January as far as public meetings go. And I was wondering how everyone was going to make arrangements so that folks can get to participate in these events that don't have access to digital. Because that's going to be a new law coming into effect, I think, January, February. And I know several of my committees, we have to make adjustments on how we're going to provide access to folks that are non-digital in tune. So what is your plans with this project to include people who don't have access?
Yeah. So Lori, I'm not sure if you're familiar with that public meeting rule, but I want to start by saying, Amy, you rock. Thank you so much for calling in today and for the input. Really appreciate your time. I really like hearing from people that are members, and I remember you providing a lot of valuable feedback at the CCO 2.0 meetings. So thank you for taking the time. And I see Lori, there she is.
Hi.
Oh, wow, you remember. It must have been good. Thank you.
Yeah, you lit up the room all right. I remember.
I want to echo Ruby and say thank you so much. We really want to hear from OHP members, people who are receiving care, and hear where the good things are and also where the struggles are. I'm not aware of that, or I'm not up to date on that new legislation. You bring up a really important issue though, and I think we are going to have to take that back as an agency and really think about, how to reach folks who don't have digital access. For example, there's lots of places in Eastern Oregon that don't where people don't have broadband or ability, very limited computer and cell access. So I don't have a good answer, but we will write it down and take it back and start thinking about that, because it is.
Yeah, that's my hopes. I just wanted to see if anyone had heard about it yet, because we were told at my city meeting that this is coming and we're going to have to figure out how to make room arrangements. And my understanding is it could be a big room with a TV, as long as folks get to participate somehow, then that would be considered acceptable. But I don't know all the details yet either.
Thank you very much for bringing it up. And yeah, there may be some opportunities to have, a community center or a room where people can wear masks and come in and participate. So thank you for that.
Okay, any other questions? It looks like Sue Ann, do you want to unmute yourself, or do you need us to?
No, I unmuted. Is there any conceptual distinction that you're making between MAGI Medicaid and non-MAGI Medicaid in this waiver application?
Oh, Lori, you're on mute.
I think I can answer that. Not really. So when in the beginning part where we talked about people will go from 12 months of coverage up to 24 months of coverage, that would be both MAGI and non-MAGI. And for those of you, just for some learning, what we're talking about are kind of what we think of as traditional OHP members. That would be pregnant women, disabled folks, and then also the Affordable Care Act folks that came on in 2014, where we were able to expand coverage to healthy working adults, both men and women. So, and we aren't distinguishing. There isn't anything in the waiver that distinguishes between those two groups.
I noticed that the non-Magi Medicaid that I am most concerned with are those who are also eligible for Medicare.
Yeah.
And is there any special thought being given to potential changes in eligibility for that non-Magi Medicaid, or to any changes in the service package? For
Yes. And I don't know, it may not have been highlighted in the slides, but and it might have been you actually in one of our prior meetings, but we did hear from members and advocates that around the need to cover or provide help for folks who are transitioning from being on the Oregon Health Plan to having both Medicaid and Medicare. So they're becoming 65 and eligible for Medicare. We do have that group in the transitions piece, and we didn't change eligibility because we don't have the ability in the waiver to change Medicare rules, but we did add their eligibility for those packages around housing supports and services and food assistance and the other social determinants of health or services that would meet social needs. So we did include that.
And if I can ask one more follow-up question before leading to the fact that this is a very small part of the Medicaid population, but do the, of course, now I've lost the train of thought. I'm so sorry. Let me mute until I think of it later. Thank you.
Okay, thank you. And you can raise your hand or unmute. I'll turn it back over to Ruby.
Yeah, do we have any other questions before we move on to public comment? Jessica Wilson, looks like you have a question.
Yes, thank you. I just wanted to get further clarification on the child welfare component of concept 2 for the transitions piece. The final concept paper includes them in strategy 2 and strategy 5 around accessing the social determinants of health services, but there was a further resource that was published on November 4th that highlighted some of the changes, and it said that they were being removed, that reserved capacity for children in child welfare was removed between the June 2021 paper and the October 2021 paper. But when I look at the October final concept paper, it appears that they're still in there. So I'm just trying to understand that clarification, please.
Yeah, so kids involved in child welfare are included. They're included in our draft application that's posted now, and they're also included in the concept paper around the transitions. So you're right. And I'm not aware of something being removed, except that we have gone back and forth around some coverage for kids, and this is just for kids in child welfare who need psychiatric residential treatment, around whether we can hold beds for child welfare so those kids don't have to have temporary lodging. And I believe that's back in. We're just talking with our child welfare partners and the OHA behavioral health team before we could finalize whether that would be in, and it is in the current application. So both social needs, benefits for kids and families who are engaged in the child welfare system, and then also this other ask to the federal government around paying for beds for child welfare, just so that those kids can move in quickly if they need psychiatric treatment.
Great, so sort of like a preferred eligibility designation for the psychiatric beds.
Correct.
Okay.
And it's a tough one. as probably many of you know, with the pandemic, just the children's behavioral health system is really struggling because of the workforce. And also that's why it took us a while to decide whether it was going to work to make that ask. So, but it was at a request of our child welfare director and that team. And we work closely with them. So
Great. Thank you very much.
no problem.
All right. Are there any other questions?
This is Sue Ann. May I step back in for one question?
Yes.
What I was wondering about was when, and by the way, I am with Sheba, for those of you who know what that's about, the Medicare concerns. Of course, Medicare rules are outside the authority of Oregon Health Authority to do anything about, but is it within the authority, or does Oregon Health Authority think about their authority to cover those things that Medicare does not cover? They would be the co-payments and co-insurance for original Medicare, and perhaps the co-payments and co-insurance for Medicare Advantage plans. Certainly there is a federal program, Medicare assistance, Medicare savings program that the state administers under the federal mandate, as I understand it, to cover for QMB, to cover some co-payments. But could the state, if it wished, under its own authority, cover more co-payments with either original Medicare or Medicare Advantage plans that are not covered under the QMB program?
Thank you for that question. The state can't, if the state doesn't need extra federal dollars or match for, bring in matching federal dollars, we can cover other payments, but that would require, the legislature to pass a law and then also have money attached to that law that would be, allow us to do that. So it would, anyway, that's how that would have to happen. We didn't include it in the waiver or as part of our ask.
Thank you, Lori.
And thank you, Lori. That made me think about something I hadn't thought about before. So thank you.
So it looks like we also have a question from Siri.
Hi, Ruby. Thank you. I put my question in the chat. I just wanted to clarify that I saw that the covered services list will be kept on the waiver. So I was just wondering if there was going to be any revisions made to that list of covered services. And if that information is elsewhere, I could, I'm happy to look that up too. Thank you.
Oh, and I didn't catch the first part of that question. Did you say something was missing?
Oh, no, I didn't say something was missing. I said that I saw that the covered services list will be kept on the waiver.
Oh, right. Yes. And let's see, we can send a link. Let me see if I can dig it up. That list is public, so it's on our website. I just don't know the exact spot right off the top of my head, but that we plan to keep, and the funding line will stay the same.
And
So
Siri, I'm happy to connect with you. This question has come up from other community partners: is how do they get involved in providing input on what's on that list, and who makes those decisions? How are those decisions made? Sort of that community engagement piece. So those questions have come up outside of this meeting, and I'm happy to circle back on that too.
Yeah, that would be fantastic, Ruby. If we can have community partners engaged with the Health Evidence Review Commission and provide input, that would be fantastic.
Great, thank you, Ruby and Lori. And I think looks like there's some additional questions in the chat, just FYI.
Yeah, Ben, it looks like you had a question. Ben West?
Can you hear me okay?
Yes.
Thank you so much. I guess I've watched a ton of these meetings, and Laura, you've seen me in and out of these for Rep Hayden. But I do have a question that continues. I see in my own practice as specifically patients from I'm a cardiology nurse at OHSU. And one of my concerns that I've seen is continuity of care, which has been an ongoing theme here, for patients that are in the county jail system, not Oregon State Corrections, but in the county jail system, and then they lose continuity of care. They can be there for a significant amount of time, but then, like, if we're managing someone's chronic cardiology issues, they don't have insurance any longer, and they start to fall through the cracks. And many of these people are there due to some type of drug addiction tied in with other issues, and so that continuity of care really is important, especially when they can also be medically fragile. And so I don't know, and I was with a patient, so I missed the first part of this meeting, but I didn't know if that was if where we are with that, if that is actually something that we're trying to make a priority to close those gaps and those disparities, and figure out if we can make sure that that vulnerable population that needs that additional care is going to be able to keep it, even though they may be incarcerated.
That's a good question. So we are asking for a coverage during incarceration for people in local jails or local county jails and local facilities, and for youth involved with youth Oregon Youth Authority. We're asking that they keep coverage throughout their incarceration. For folks who are in Oregon State Hospital and in state prison, we're asking that they their coverage resumes 90 days before they're released, and that's a limited benefit to help with care coordination and accessing social determinants of health and like housing to be ready for when they are discharged.
Can I ask a quick follow-up?
Sure.
So can you just explain the difference between why somebody's in a county jail or local jail and they have that gap in care, but they tend to still get a more continuity of care if they're like in the Oregon correction system? Like what is the divide between like somebody at Oregon State Penitentiary and somebody at, like, I don't know, Columbia County Jail?
I don't know all the details, but I'll tell you what I do know. And I think there are CPOP members that work with corrections regularly, so they probably know. Okay, Amy, I can see she can answer that, so that'd be fantastic.
Yes, the way it works, I've been at this 30 years, okay, trying to get this solved. The way it works is there's a distinction in where prisons lie in the scheme of funding. And so typically if an inmate goes in and he has less than 30 days, all he needs to do is take his exit paperwork down to the local office and they'll reinstate him in all the services. The difficulty lies is there are rules around what you're allowed to have and what you're not allowed to have when you're incarcerated. And then there's another angle between state and county because of how everything is funded. The general fund that Multnomah County has is what pays for all the local jails, the health, all that work. And I don't want to toot my own horn, but I got to tell you, it took me 3 years to get the county to open up the medical database inside the jails. They're an entire separate entity and they're listed under environmental justice in our law books. So you have to do a lot of studying to see that it's all based on funding streams. If there was enough money and if the laws were rewritten, then the counties might be able to do more with holding their services. But for now, less than 30 days and they can get reset up immediately. They just have to go to their local office. So anything after a year they will be automatically put on having to renew or start over. And the state jails are equipped with, what do you call them? OHP assisters. So they have to have at least a year of their time left in order to get access to these service programs. So it's time and it's location. And if we can rewrite the statutes in our state around criminal justice as a whole on these subjects, we can definitely change the way things operate. But right now, it's all tied up in like 5 or 6 different separate circles. Because I've been trying to do it for 30 years, figure this out, and I finally got it understood. It's a money thing between the federal government and the judicial systems. But it's not, they don't get eliminated unless they do more than a year. It's all on hold. They just have to take their exit paperwork down to their local office and get reinstated, because I do it all the time for clients. So now that I understand how it works, I can help other people, help people that make it work. That when they're in and out, like in 24 hours or 72 hours, or even a week, there's no time for collaboration. It's really hard. So we need more outreach workers that can meet them outside the jail and take them down and get them certified. Because I don't think they're going to do it inside the jails. We actually need an OHP assister inside the jails. That would help a lot. So I hope that helps answer your question. If you have any more, you're welcome to email me. This is what I do for a living now, forensic peer wellness specialist. So I'm trying to get this figured out every day. Thank you.
A patient not getting specialized cardiology care for a year, if that's right, like if they can fall through the gaps that long, even if it's 90 days, that could be super significant to someone's overall health, especially my patient population, which sometimes, unfortunately, falls into that part of the justice system. So I think if there's a way to bridge that gap, that's the way to help take care of a vulnerable population that's often doesn't have the same good health outcomes that we like.
Oh, I know what that answer is. Then stop requiring referrals to go through the PCP. If you know somebody has a heart condition or a lung condition, I'm dealing with that with diabetes, trying to get my clients into an endocrinologist. But I have to go through a PCP. I have to get permission from Care Oregon, and these people are already documented. They should have seen specialists years ago. The mental health and the substance use disorders are making people blind to the secondary and most important factors of specialized healthcare. I see it every day. We got to stop the 3-layer process for getting them into specialists. And now you have to figure out how to get them to go to a specialist. These folks are traumatized. They don't even understand the reasoning for going to a specialist. You and I do, but my clients do not. Yeah, they end up going to the ER every other day because they won't go to their PCP.
Thank you
It's
for
crazy.
sharing,
It's
Amy.
crazy.
Really appreciate you painting the picture, telling the stories. And I will definitely be sure to circle back with you and kind of share where we are internally and gather up more of your solutions that you're sharing today. Appreciate your time as well, Ben. I have a person that I love and adore in my life who has heart issues, that was born with heart issues. So we will be putting our heart into this. Know that. Okay, it looks like we're having that interpreter problem again. Perhaps interpreters have switched. Is that what happened?
No, I think you're timing out. I think there's a time limit to those rooms because this is the second time it's happened and there might be, a time limit set on your service. You may
Would you
wanna
like us
check
to
it
log out and
out.
come back in?
Yeah.
This
it
is
might
a Spanish
help.
interpreter.
Okay, and if we could just have one interpreter log back in this time.
Okay, I
I'm
will log
sorry,
back in,
we're not
Chris,
gonna be
and I'll
able
finish
to.
this up.
Thank you. All right, so while that's happening, we do have a question in the chat box related to budget. Lori, are you still with us?
Yes, oops. Yes, I am. Just trying to get back on. There you go.
Okay, so let me see if I can find it. It got a little buried when a bunch of other questions got molded in here. I think it was Christina that had a question. Are we allowed to ask how much the proposed budget will be? It looks like a few people have that question.
In terms of, I guess my question is what budget? We do have, I will say this, and maybe this is what you're asking about. If you look at our draft application that's posted right now, there is a spreadsheet that shows how much we expect to spend on the Oregon Health Plan with the waiver. It shows how much we spent across this current waiver, and then how much we spent in the proposed, we plan to spend in the proposed waiver, and then what we would have spent if there was no waiver. It's in the billions of dollars, but I don't have the numbers right off the top of my head.
Christina is saying, how much are you thinking this is going to be in the proposal to the federal government? If that didn't answer the question, Christina, will you let us know? I'm not sure if you could hear the response.
And we are asking for extra federal money. And that it will take negotiating with the federal government before we know exactly how much that is. But it's in the hundreds of $millions. So.
Okay. Amy, your hand is still raised. Is that from previous question or is that a new question?
I'm gonna lower it. I'm good. I'm on the road and it's hard to pay attention. Right, thank you.
Okay. All right, well, we're going to get started with public comment. We're running close on time. If there are people who need to leave now, you can submit your public comment in the chat box. Just know, we are going to be tracking your comment word for word. And we will need to know which organization you're with, your name, your full name, other details. Are you submitting your public comment on behalf of a community member enrolled in the Oregon Health Plan? Are you yourself submitting the comment on behalf of yourself as an OHP member? I want to make sure I cover this all. And how you're affiliated with your organization if you're speaking for an organization. So if you need to go, just be as detailed as possible. And most importantly, let us know in the chat that you are submitting public comment. And Karina, if you want to, are you able to pull up our timer?
I can only share my screen. Okay, I should be able to in just a second.
And then Carlos, did you ever get added as an interpreter? Carlos? Yes, you're added as an interpreter, is that right?
English audio channel.
Say that again, Carlos.
So you won't be able to hear me unless you click the English audio channel.
Okay, thank you.
Of course.
All right, so we do have, I'm not sure if we have Josh today with All Care, Josh Ballack, wanted to provide a comment. Are you logged in today? All right, we can come back to you. If there are other individuals who would like to provide public comment today, please unmute yourself and we will start the timer.
Are you wanting us to just start? Or are you going to call on people
Yes,
that are unmuted?
thank you, Colleen. You can lead by example.
Oh,
Thank
sure.
you so
Okay.
much for just jumping in. Really appreciate it. Do you want us
Hi.
to, we're going to go ahead and hit start. And if you could provide your name, the organization you're with, that'd be great.
Ah, I already have 10 seconds. I haven't started.
We're going to we'll reset it for you.
My name is Colleen Ruland. I'm the director of the Oregon Pediatric Improvement Partnership. We're a statewide organization that works across sectors on population improvement efforts. As an organization and person deeply committed to and experienced with systemic change, we have found developing reliable and meaningful measures has always been a critical tool to drive and inform valid improvement efforts. What is measured, how it is what we'll be focused on. Given that nearly 40% of Oregon's Medicaid insured children, and particularly children of color, are covered by Medicaid, we are extremely supportive of the elements of the waiver that focus on children and focus on addressing structural racism. Within OHA and OHPB's health equity definition and aims, a key component we see for children in Medicaid and CHIP is the intentional inclusion of disability. For children with special healthcare needs in Oregon, OHP is the safety net for addressing and covering their medical, behavioral, oral, and care coordination needs. The magnitude of children that count on Medicaid CHIP in Oregon, according to the 2021 data, health complexity data that have medical complexity, is 145,000 children. So that's more than 1 in 4 children publicly insured have a complex medical condition. We have significant concerns with the waiver proposal related to incentivizing equitable care. We appreciate the overall support the intent and purpose of the upstream and downstream metrics. However, the current proposal will result in no metrics that will ensure equitable access to, receipt of, and high quality of care for children with special healthcare needs. The upstream metrics proposed, although critical in addressing some of the historical inequities and social challenges faced, do not contain metrics focused on children and youth with disability. The etiology of children with disability is not caused by lifestyle or lifestyle circumstances. The current proposal for downstream metrics is that they are anchored to this core set. There are no metrics for the population of children and youth with special healthcare needs in that set. And yet this is the program that's supposed to ensure quality for them. There are no metrics related to care coordination or care integration. And there are no metrics related to behavioral health that would address the social complexity that we know 2 in 5 children experience. We look forward to being your partner if you're willing to consider solutions and hope that this can take into consideration for the important children that Medicaid serves.
Thank you, Colleen. Wow. Take a breather on that one, right? I know these timers, I tell you. So I'm going to check in one last time here. Josh from All Care, did you join us today? I know we're on a timer. Definitely want to make sure we're pacing ourselves. We do have an interpreter who is interpreting in Spanish, and we just want to be sure that we're kind of balancing both. I know that's really difficult and something to consider for future meetings. Okay. If you'd like to provide public comment, if you could please raise your hand and let us know so we can be sure that you're unmuted and start our timer. Okay, Travis.
Sorry about that. Okay. So I know you folks were predominantly going over the Medicaid eligibility piece of OHP. To my understanding, EBT food stamps also falls under this. Is that correct?
So Travis, will you tell me a little bit more about which organization you're with?
Yeah, so I'm with the Community for Positive Aging. I'm an enhanced resident services case manager who works in the downtown area with folks who are in largely subsidized housing. Basically, what I'm running into is increasing needs for folks who, live on the economic margins. They're losing access to their providers. A lot of them just haven't connected with folks in an awful long time. And right now, it is an absolute nightmare for them to get certain paperwork from things like Social Security for updated benefits, award statements, and the like. I know a lot of communication happens on the back end, but I have noticed folks who are just getting their food stamps turned off for lack of recertification. And I don't know if your arm of OHP is sort of caught up in that, but it's extremely problematic. It is very traumatizing for our folks, and it's causing food insecurity and instability. At least through COVID, it would be great if some kind of waiver could be or procedure established so that folks aren't required to jump through hoops to maintain benefits they've already been certified for. Like it's usually just to quantify their income status. And I have to imagine the number of people who substantively improve their income to a point where they're no longer, where they go from full eligibility for food stamps to no eligibility for food stamps has got to be much smaller than the amount of work the state requires on their behalf to maintain.
Thank you, Travis. I appreciate your input. And I believe I understand, just to confirm, when people want to continue with their renewed SNAP benefits, there's barriers they're running into. And so I'm going to circle back with you. We do have a few community partners that do sort of advocacy support and some of our internal partners that we can work with. So I will be circling back with you.
Great, thank you.
Thank you. All right, so just a reminder, we are taking public comment. Public comments on the waiver draft application will be documented and reported. We will need your full name, your statement, and if relevant, your organization. Of course, we already answered a lot of questions, so we want to make sure we spend the next few minutes on public comment. If you would like to jump in, please raise your hand so we can ensure that you are unmuted and start the timer. I know, a lot to process, right? So we talked a lot about the different final concept papers, and we've talked about where this draft application is available for you to review. If you haven't had a chance to visit our 1115 waiver Medicaid website, I would encourage you to do so now. At the top of the website, you'll notice a button in Spanish. So you can click the button that says Spanish to get all the documents and updates in Spanish. So just know that we're going to continue to collect all your comments through January 7th. But we still have time today if you want to verbally share your public comment. And again, the benefits of this is to document, know where your comments are coming, and to really hold OHA accountable to responding to your comments and your thoughts. So do we have anyone who would like to share? Don't be shy. Anything you are seeing in our concept papers, our draft application, things that need to change, concerns? And Travis, your hand is raised, but is it raised from the previous question?
My apologies. I meant to lower that.
Okay, I thought you had a follow-up. It's okay. All right. Well, I'm gonna go, I mean, we can end early so you can get to lunch if you'd like. If anybody else doesn't have a comment. And if you just want to process this and think about it a little bit more, that's okay too. Remember that you can submit your official comments. You can encourage the people you're working with, the OHP members, to submit their public comments via our 1115 waiver email address. I will be sure, we can be sure to put that in the chat box. Karina, I think you have, I think I can do it actually. I'll try to do it here before we sign off. Those comments can come in multiple languages. So if you have clients who want to advocate for themselves or their communities, they are welcome to submit their written comment. And we do have until January 7th. Just remember, we will need your full name, your statement, and if members are submitting on behalf of themselves as an OHP member, we would like to know, or if you're submitting comments on behalf of your organization. All right. Thank you, everyone. We will be in touch. And for those of you who are interested in this recording, it will be posted to our website.
Thank you for a great meeting. Contact me anytime, okay?
Thank you, Amy. Will do.